And with that, I'd like to turn to Dr. Daniel Yang, Program Director at the Gordon and Betty Moore Foundation, who will provide some brief remarks on the meaning of diagnostic excellence. Daniel, thanks.
Thank you, Derek. Good morning. First, I want to echo Dr. Beinman and Dr. Angus's warm introduction and welcome you to today's workshop. I also want to add my gratitude to the organizers at the National Academies, the Excellence Steering Committee, and all of the speakers that are presenting today. Thank you. As Derek mentioned, I'm Daniel Yang, a program director at the Gordon and Betty Moore Foundation, where I co-lead our Diagnostic Excellence Program, which plans to invest around $100 million to improve diagnostic outcomes for patients in the US. Our commitment to this topic was inspired directly by the excellent work of the National Academies and their 2015 report on improving diagnosis. Now, some of you may be wondering how we define the term diagnostic excellence. Again, borrowing from the work of the National Academies and their landmark 2001 report, Crossing the Quality Chasm, our framework of diagnostic excellence, which we recently published as a viewpoint in JAMA, incorporates the 6 domains of healthcare quality. We believe that diagnosis must be safe, timely, effective, efficient, patient-centered, and equitable across populations. And while all 6 of these dimensions matter, we notice that they're frequently in tension with one another and often result in difficult trade-offs. For example, in an effort to improve access and convenience and reduce costs for a home COVID test, what are we willing to sacrifice in terms of accuracy against the gold standard? The topic of our workshop today, unfortunately, continues to remain incredibly relevant and timely. The COVID pandemic has underlined the critical importance of timely, accurate, and equitable diagnosis. It's also provided a crash course to the entire country on the various types of diagnostic modalities like PCR tests or antigen-based tests. It's educated us on the regulatory processes to review and approve diagnostics. It continues to remind us of the logistical and supply chain issues that have resulted in backlogs and delays. And it's even introduced Bayesian reasoning and diagnostic test characteristics to millions of Americans. In my clinical work in the emergency department, I frequently had patients asking me sophisticated questions about pretest probability and false positive rates. The COVID pandemic has also resulted in a number of important changes that have pushed us to reconsider some fundamental features of clinical diagnosis. For example, where a diagnosis occurs. We saw a shift from the brick and mortar settings of hospitals and clinics, and diagnosis has instead increasingly moved into people's homes and places of work. COVID has also pushed us to reconsider when a diagnosis is best rendered. It's blurred the lines between asymptomatic screening and symptomatic diagnosis. At the advent of all of these new technological innovations, including the use of wearable sensors and AI predictive models, may hint at what the future of diagnosis might look like. The orientation of our workshop today is not meant to be simply retrospective in nature, but rather forward-looking. What are the lessons learned from the pandemic that help us advance our imagination and our approaches to better achieve excellence in diagnosis for the years to come? I'm really excited to hear from our outstanding lineup of speakers and to engage in robust dialogue with our audience. Thank you again for joining us today. I'll pass it off to Andy.
Well, thank you so much, Daniel. Wonderful framing comments from you and Derek. So I think we're ready to turn